cancer is the uncontrolled and unpredictable growth of certain cells in the skin. The term cancer, the word cancer comes from means the word crab, and that implies unpredictability. Skin cancer is caused by a combination of genetic and environmental factors. We can't do an awful lot about genetic factors. We can't choose our parents, and we can't at the present time alter our abnormal DNA, although that may change in the future. But what we can try and control to a certain extent are the damaging phenomena in our environment that predispose us to skin cancer, and here I am talking about sunlight. So what is it in sunlight that's damaging? Well, sunlight consists of a whole lot of radiation, which is essential for life on Earth and which reaches us through the atmosphere from the sun. It's got a whole gamut of rays in it, very low wavelength, high energy, X-rays, ionizing radiation, ultraviolet C and so forth, which is cut off from our atmosphere. Very biologically active, very dangerous, doesn't reach us. But what does reach us here on Earth are the ultraviolet rays, the ultraviolet B and the ultraviolet A rays. So what UVB does to our DNA is that it cross-links the purine and the pyrimidine bases, in other words, the building blocks in our DNA. It is tattooing our DNA, and that eventually will lead to cancer. UVA, which is slightly longer ultraviolet, we used to think was not damaging and not mutagenic, but now we know that it is also damaging, but it doesn't directly attack the DNA, but it causes excited oxygen species and other free radicals to form, and they then whiz around and damage our DNA strands. So both UVB and UVA radiation cause skin cancer. Sunlight causes skin cancer. When we're exposed to ultraviolet, our skin tans. What a tan is the melanocytes in our skin, the skin that produce the pigment called melanin, produce more melanin and send the melanin out as a response to DNA damage. So it's a protective response to try and stop us getting more damage, but the trigger for it is damage. So the tan is initiated by damage. In other words, there is no such thing as a safe tan. Skin cancer is classified as melanoma skin cancer and non-melanoma skin cancer. Melanoma skin cancer comes from the melanocytes, the pigment cells in our skin, and non-melanoma skin cancer encompasses basal cell carcinomas or squamous cell carcinomas. The other name for basal cell carcinoma is a rodent ulcer, which you may have heard of, and these are very common indeed. They're directly related to sun exposure. They're more common in fair-skinned individuals, but they do not spread elsewhere in the body. So they are not life-threatening. However, they can be locally recurrent and infiltrative, hence the name rodent, implying sort of local gnawing away. Squamous cell carcinoma can spread elsewhere in the skin, and melanoma is unpredictable, and that can also spread. As always, prevention is better than cure, so keep out of the sun and reduce your risk of getting skin cancer. When you, or if you do get a skin cancer, you may well be offered surgery. And there are different surgical modalities, different surgical techniques that are commonly used. If surgery, for whatever reason, say it's at an inaccessible site, or for some reason you can't have surgery, then you might be offered, certainly for a basal cell carcinoma, radiotherapy. Melanoma is not generally radiosensitive. There are a number of chemicals or creams which can be applied, which can be helpful particularly if the skin cancer is superficial, so superficial basal cell carcinomas, or when you've got precancers, particularly if you've got a lot of them. Photodynamic therapy, or PDT, is when you put a chemical on the skin, and this chemical sensitizes you to visible light. The combination of the chemical and visible light causes a marked inflammatory reaction, and that then destroys the skin cancer. Chemotherapy might be used if a cancer spread elsewhere in the body. In the last decade, we've seen an explosion of really exciting biologic molecules for treating cancer, including melanoma. So-called BRAF inhibitors, checkpoint inhibitors, they're targeting very specific molecules in the skin cancer pathway. These drugs show a lot of promise, but this sort of treatment is still in its infancy. The outlook for skin cancer depends on what sort of skin cancer you've got. Basal cell carcinoma or rodent ulcer has a really good outlook, a really good prognosis. It can be locally recurrent, it can come back in the same place, hence the term rodent, but it won't spread elsewhere in your body and it will not be life-threatening. Melanoma, malignant melanoma, is less predictable. And the outlook of a melanoma depends on a number of factors. And generally, the earlier it's diagnosed, the better it'll be. But the factors that will affect whether or not it's spread are the sort of cells, how active they are. How deep the melanoma is spreading is very important. And these indicators are given by the histopathologist, the person who looks at the melanoma under the microscope for us. So the deeper the melanoma is going in the skin, the more likely it is to have breached the skin barriers and to be on its way to target other areas in the body. In addition, if tumours are spreading down nerves, they're more likely to spread. If they're already inside blood vessels, they're more likely to spread, and so forth. We protect ourselves from skin cancer by protecting ourselves by sunlight, which is the environmental agent that mutates our DNA and therefore causes skin cancer. And we protect ourselves from sunlight by using sun cream, but sun cream is not the only answer. Before using sun cream, or as well as using sun cream, we must keep out of the sun, particularly between the hours of 11 and 3 when we're abroad on holiday in a sunny place, because between the hours of 11 and 3, those UVB rays, which are the rays that are directly mutating our DNA, are at their strongest. So between 11 and 3, we should be coming indoors, having a nice lunch, having a siesta, and only re-emerging after 3 o'clock. When we are exposed to sunlight, we should cover up. We should wear a hat, we should wear protective clothing, but remembering that the UV rays can penetrate through loosely woven clothing. And then, number 3 is using our sun cream. So it's an adjunct sun cream, it's not the be-all and end-all. And the mistakes we make with our sun cream is firstly that we put it on too late. We pop it in our bags, we haven't had time to put it on, and by the time we put it on, we've already, unbeknown to us, damaged our DNA. The other mistake we make is that we don't put enough on. None of us put enough on to get the protection we think we're getting. You have to put an awful lot on, and there is also the issue of reapplication. So to summarise, we should keep out of the sun, cover up when we're exposed, and use sun cream liberally and reapply it.